Welcome back to another episode of Sports Medicine on Tap. My name is Brandon Online. I'm sitting at Neck of the Woods Brewing Company in Pittman, Jersey with a full table full of smart, intelligent folks.
Yeah.
Dr. Frey, how you doing?
I'm not one of them. I'm doing well. Mid-nor'easter. In the Northeast on Tuesday night. Well, what are you going to do?
Yeah, what do we do? We're
minus
here.
minus the snow.
Minus the snow.
Oh, man,
yeah,
if this would have been a snowstorm, it would have been so good.
Brutal. Yeah. It would have been so good.
It would have been so, we wouldn't have been here, that's for sure.
Heck no. My wife tried to talk me out of coming down as is. She's like, it's supposed to be really bad. It'll be all right.
All-wheel drive.
All-wheel drive.
We'll
That's exactly right.
So, just a quick touch on what we talked about last week.
Took a lot of focus to get here.
Oh, a lot of focus to get here.
Nice.
I was so amped up last week, and I thought I was rolling with smooth pursuit and everything, and I forgot to hit the record camera on your side of this table last week.
It's all right.
So all our fans got to miss out your excessively dilated pupils from your eye doctor's
That's
appointment.
right. All right, I came here right
anything
after.
else I was in the
You
background.
guys are showing up with all your doctors, post-doctor appointments.
That's right.
But tonight I utilized some performance enhancement, and I went with some Magic Mind to kind of make sure I didn't mess up, and I hit all the record buttons on all our cameras, so everything's kind of running smoothly for now.
Tell me a little bit more about Magic Minds.
Sure. The nootropics are definitely working right now. I feel like I'm skating really high. But no, it's a nootropic, very small little shot. Got some matcha, some green tea in there.
Yeah.
It's got some different mushrooms and all those things. You kind of take it. I've been taking it kind of like as a supplement to the second cup of coffee.
That's right.
Or as a replacement.
I feel like that's the best spot for it.
And today was perfect because I have a 1.5-year-old son, and I was getting ready to go to the grocery store with him, and he took my first cup of coffee and dumped it all over the floor. So I'm down a cup of coffee today. So I
To your room.
Yeah. I made it up, and I had some of the Magic Mind, so I got us going.
Yeah.
And as we mentioned last week, only this January they are running a special to help you gear up for your New Year's resolution, fully focused. You can get 1 month for free when you subscribing for 3 months at magicmind.com/JANMedOnTap. And then with our code MEDONTAP20, you get an extra 20% off, which gets you a total of 75% off. And this only lasts to the end of this month of January, so hurry up before it goes away.
Heck yeah, man.
So
I'm
definitely
doing it.
That's nice.
go for it. You got to give it a shot. So, Dr. Frey, tonight we have some familiar faces and some new faces. Who do we have?
Brand new faces. Well, first we have Dr. Bernardini, and if you're a listener to the show, you know who he is. He's been on like 1,000 times, right? Like one of our regulars. Honestly, the creator of the show, right? Like it was your idea, buddy. And
Love it. You guys have done amazing things with it.
Thank you. And then we have our new guy, the freshie. That's the nice way of saying it.
Freshie.
So welcome, Dr. Kevin O'Donnell. Tell us a little bit about yourself, where you're from, how you got here, and what's going on.
Yep.
I don't know what I'm doing here. I just over at the bar real quick.
Yeah, that's right.
You're outside. I was like, come on in, buddy. We'll give you a
Hey,
beer.
we know you.
No, glad to be here. Thanks for having me. This is pretty exciting.
Yeah.
So Kevin O'Donnell, new to your group. Super excited to join you guys.
Yeah.
He's starting up next week, pending some credentialing
Hopefully.
stuff. Hopefully.
Working
fingers
on it.
crossed. I'm from here. Grew up in Tabernacle. Was living out in Medford Lakes for a while. Did a lot of training down in Miami, so I've been down there for a few years, and now back up to establish some roots in South Jersey.
All right.
So,
Awesome. Good to have you, my man.
yeah, pretty psyched to be
Glad
here.
you're finally here.
Yeah. And so with the nor'easter outside, and it's not nor'easter. It's just pouring, raining. Are you regretting that decision already?
The wintry mix.
Yeah.
That's right.
It's like a little baby hurricane. It's fine.
It's
You're
a
all right.
baby hurricane. That's exactly what it is. So, all right, sports medicine fellowship trained. Any kind of specific areas you like the most? Things you work on? Any specific niche?
Yeah, so, sports guys, we do a lot of the same stuff.
Sure.
I trained at University of Miami, and then I did my fellowship up here at Jefferson at the Rothman Institute. What I focus on predominantly, shoulders and knees, as do most sports guys. Niche-wise, I can do some hip arthroscopy, which I do enjoy, so things like labor repairs and camera sections, any impingement that comes across, which is a little bit more unusual for sports. And then I also do some elbow arthroscopy as well.
All right, man.
Perfect.
Yeah.
It's awesome. Add some tools to the toolbox.
Heck yeah. Some stuff that our group really needs. It's
Yeah.
perfect fit. Loving it.
That's my goal.
Yep.
Add into all the pieces. So tonight we don't really have that nail on the head, that pinpoint target of what we were talking about. We kind of went kind of wide spectrum of different injuries.
Yeah.
And what better way to do that and cover a bunch of different things? Just talk about like we kind of tail end of the NFL season. NFL regular season's over now, and we're going in the wild card weekend, and a decent list of injuries across the board for all the different teams. Everyone's a little bit banged up, so we get to talk about all different kinds of things. So where do you want to start?
So yeah, the MO of the show has typically been, pick out one injury, one specific injury that might be impactful to, a well-known player, and kind of dissect that injury and what it means. And just like you're saying, today's I think approach is going to be a little bit different. Mm-hmm. It's the NFL. We all love it. Playoffs are on the horizon.
I don't love it.
You don't love
right
it?
now.
No, not right now. Yeah, no, I get it. Do you live in Philadelphia?
Yeah, no. It's been painful.
I understand. But it's still fun, man. It's still the NFL. And so it was like the perfect show to kind of do this, like go through each team, figure out, what are some more of the impactful players that may or may not be participating in the, throughout the playoffs, and just a little tidbit on each.
Yeah.
And the truth is, we only have so much information about their injuries, right? And we talk about it every show, like the disclaimer. We don't actually have access to their medical charts. We don't actually know their specific injuries. We just have access to the same information that generally the public has access to. But sometimes it's fun to talk about those specific injuries when you have a little more knowledge about them.
Right.
But yeah, I don't know. So for me, the one I would like to talk about the most, because as we all know, I'm a Steeler fan, and how the heck they made the playoffs, I have no idea. But they are in. And the Steelers have a lot of faults, but I have to say I think they have the best defensive player in the league. And of course, with like 3 minutes left in the game, freaking made of glass, man, injury. So when hyperextension, it looked like, I don't know who was watching, but it looked like a hyperextension injury. Yeah, like someone backed into his knee, it looked like his knee kind of went back the other way. And I was like, it didn't look terrible. Maybe it's just like a mild hyperextension. We'll hopefully be back week 1. And then Adam Schefter initially reporting grade 3 MCL. I was like, there's no way that's grade 3.
Yeah.
There's no way. And then more recently, I guess the next day, basically, they came out in the grade 2, probably grade 2 MCL, which, I guess I'll sort of take it, but I don't know. All right. Kevin, welcome to the show. Grade 2 MCL injury.
Trial by fire. Let's see if we made the right decision.
So in terms of coming into playoff football, right, we've got a grade 2 MCL, which occurred about 4 days ago now.
About that.
Yeah, give or take. Likelihood of your man making it back to his first round of playoff games is virtually non-existent, I would say, at this point, unfortunately.
Agreed.
When we look at the injury, do we go through the specifics of what this thing is?
We will, yeah. For a couple of them, we'll get a not super detailed, but a little more detailed. So run with it.
Sure. Yeah. The MCL we're talking about is a medial collateral ligament. When we grade these things, so to go into the collateral ligaments, we break it down by 4, which is sort of accurate, but not really. So the famous one is your anterior cruciate ligament, posterior cruciate ligament. These are both in the middle of the knee joint. They help with rotational stability. They help with your tibia moving forward and backward relative to your femur. The collateral ligament on the outside, the medial collateral ligament, the one we're going to talk about, and we're just going to ignore the outside of the knee in terms of the
That's a good plan.
Fibular collateral ligament, the posterior lateral corner. It gets a little bit too much in depth. So the medial collateral ligament, it's a band of tissue, runs from the inside of your thigh bone down across the knee joint, kind of attaches to your medial meniscus, which is that shock absorber in there, and then kind of cruises past down onto the top part of your shin bone on the inside, so your tibia. What it does, it prevents your tibia from moving kind of in that knock-kneed position, and it's a rope, if you will, that connects the two bones together. Okay. When you get hit, so if you get hit traditionally from the outside of the knee so that the knee is pushed inward, it can stress that ligament, and it can either stress it with a strain or a sprain, and we can get lower grade injuries where we just kind of damage those fibers a little bit. And when we test that out on the field or in the office, you're not really going to get a lot of gapping in there. You're going to still have a nice stable knee, but it will be sore. You will be tender over that area. As we progress our way up the injury spectrum, now we've started to damage the overall structural integrity of the ligament. So when we test it out, it's a little bit looser, so we get a little bit more play in the knee. And then when we get past this grade 2 injury, which this one's being called, and we're going up to a grade 3, now we almost have an incompetent ligament. So meaning that when we stress it, it just opens wide open. So grade 2. Not the worst.
Not the worst.
But is Watt getting back for your playoff game? He is not. Right? These take several weeks to resolve. even with appropriate like a stabilizing brace, it's highly unlikely he would be able to perform at the level that he needs to.
That's the important part, I think, at the level that he needs to.
Yeah.
Now, could you put him on the field? Yeah. Sure. Will he be
Effective?
No.
Probably not. So I'm gonna.
The Eagles defense could maybe use him.
They need anybody.
I'm gonna. The plot thickens a little bit, right? I'm gonna throw a little spice in there. We've had a few shows in a row where somehow, one way or another, this gadget, this gizmo from Arthrex has sort of come up, a tight rope or whatnot, and then there's something called an internal brace, right? Like, and really, honestly, I think that the internal brace probably gained a lot of notoriety, not notoriety, but acceptance and attention, really when it was first put in an MCL. Now, typically, grade 3, the complete disruption of that ligament, you throw in this internal brace to try to keep the leg together while it's healing, the ligament's healing around it. I don't know. What do you think? Is there any role for something like that I'm going to ask Brad, in a grade 2 injury?
Yeah, I don't think so. I mean, the reality is, the right thing to do for him is to allow his body to heal the way it needs to heal. And even, internal brace is a little bit, I think, controversial too with, when we do ligament reconstructions, there's some thought that if you want to protect that reconstruction, you put one of these internal braces in, which basically acts like an actual rope instead of a kind of a theoretical rope,
Right.
which is what our ligaments are. And it protects that reconstruction until it heals, and that healing can take some time. And it's nice if you've got something there that can allow somebody a little bit of protection. Where I don't use a lot of internal braces in my practice. I feel like, if we're going to go and reconstruct it, I think it's important for the ligament and the reconstruction to be well done to the point where you don't have to rely on that. And then so that the body can actually understand, the healing tissue has got some I don't want to call it intelligence to it, but it has to be exposed to what the body's going to ask it to do.
It responds to stress.
And therefore it responds to stress. And I think that, and that's some of the concern with these internal braces, that you have something called stress shielding, which can affect how these ligaments heal and maybe some of their remodeling characteristics. And so I have not really jumped on the bandwagon like some others have. I think it's got its place. I have used it. I mean, I use it for certain things, but for grade 2, I wouldn't. I would just unfortunately accept that it's one of these things that is just not an ideal time for him.
What do you think?
And we'll get better.
I would actually echo some of those points. I'm not huge on it around the knee specifically.
That's the right answer.
Even
if you don't really agree at this early stage. Yeah.
Right.
But there's also, not to get too into the weeds, but you're also, in using these internal braces around the knee, you are burning some of your real estate with bony purchase, right? So if we're doing knee procedures, a lot of times we're worried about what's called tunnels, which we use to reconstruct ligaments. And when we put internal braces in, we need to put it somewhere. And so when we put it somewhere, you can get into a kind of a real estate issue where you got too much going on in that location. And the other valid thing with this is over constraining the medial side of the knee, right? So you try to put this thing in, you try to tighten it up, and a lot of more is better.
Ortho tends to
let's go big, let's go real tight. And the reality is you can make it too tight. And when you make it too tight, you make the knee too stiff, you increase the compressive loads across the medial compartment, you can worry about more damage down the line in terms of too much pressure. So, I agree. I think you fix
those are great points. Yeah.
Fix the ligament down, let it heal, go through the appropriate rehab. He's out anyway. So this isn't like we're speeding something. This didn't happen in July in an off-season workout. This happened now. So he's out, and just let him recover for next year.
They haven't lost yet. What do you mean recover for next year? But I understand they're playing the Bills, so basically
that's tough.
I know.
Yeah.
It's a tough matchup.
Might be a shot if they make it all.
They still have to
way,
play the
right?
game.
You still have to play the game.
They still have to play. Exactly. They still have to go through it.
So let me throw that out there. So
the Bills could take a dive like the Eagles took a dive in the second half of the season.
Or they could take a dive like the Bills took a dive in the first half of the season.
Yeah.
So playing devil's advocate, and then we'll move on after this one last point. So let's say that the Steelers do have a run here, right? Like Pickens decides he wants to play every single game, and because of that, now they're pretty good. Do you think 2 weeks from now, 3 weeks from now, is there a possibility?
I think 3 weeks there's a possibility.
That's where I put it. Too.
And I think that, I mean, personally, I think that's kind of optimistic, but it'd be a very tight window at 3.
All right.
Kevin, one of the things we like to do is predict the future on this show.
Right.
And then
the
later
best.
come back and ride each other about
Perfect.
whether we're right or not.
That's
Yeah.
exactly right.
Yeah. So we'll call each other out later. Like somebody will let me know that I was wrong about the 3 weeks.
Right.
I want to go back to like 6 weeks ago, and like somebody was probably like, "Oh yeah, Eagles they're gonna have a bye."
Yeah.
Number 1 seed, sure.
Brad's very good.
That
at,
would
like,
be-
I called that exactly right.
Yeah.
Why did you screw that
Yeah.
one up? Like.
That would be another good injury if we're done with that one.
Let's
I
move
think
on.
another obvious injury
That was
is
fun.
Jalen Hurts.
Yeah. Right.
You know, he takes a helmet to the hand, looks down at his hand immediately and shakes his head. Clearly something's not right. And then, you know, one of the next shots is he's standing on the sideline with his finger that doesn't look quite right. And I think for us there in sports medicine, we kind of knew right away that looked like a dislocation of his middle basically joint in the finger.
Yeah.
And which is not an uncommon injury, but not something you want to see on the dominant hand of your quarterback.
I gotta hand it to him, man.
Ah.
Like,
Nice.
Hard on it, too.
Well
That's
done.
good.
Like he took it like in stride. Like you see it happen.
He's still stone faced.
Like,
Yeah.
he looks down. He's like, you know,
Yeah.
and just kind of
Yeah.
walks off like
Par
like,
for the
like it was
course.
nothing.
Yeah.
Yeah.
Like I remember dislocating my pinky playing basketball.
Yeah.
Like, pointing due east, and I was like,
Yeah.
you know, like in shock.
Yeah.
Like he took it like it was nothing.
Yeah. That's him, right?
know.
That's his
Yeah.
personality.
Tough dude.
Yeah.
Yeah. So what happens with that?
So he did come back in the game, right? So
Yeah, which was impressive.
impressive. And you see him on the sideline, like throwing the ball around and trying to get ready. And oftentimes, if it's a sort of straightforward dislocation, that you know PIP, so the joint that's sort of closest to the hand, not the one that's connected to the hand, but one closest to the hand, depending on what direction dislocates. And his looked like it went bowler, so like the middle phalanx, the end of the finger went towards the palm, and it kind of gave that sort of S swan neck looking shape and deformity. They're typically pretty easy to reduce to get lined back up. Oftentimes you just kind of go over there and pop it back in. Oftentimes a player does it himself. In this scenario, I think that the trainer came over or the team doc came over and popped it on in.
Yeah.
And then you tape it to the finger next to it and see how you do. I find my experience with these things has been immediately it's actually not terrible. You have it taped up, you throw the ball around, and then the next day,
Yep.
it's swollen to all get out. You're super stiff. It's so much more tender. So I'm kind of curious. Like I was impressed he came back as is. Really curious how to see how it goes next week.
Yeah, I agree. I agree with that. And assuming that it's not a complex dislocation that's associated with like a fracture.
Totally
So
different scenario.
there's some things that can happen that I imagine
Rotation.
they check because they brought him in, right? So I imagine.
Yeah. And I'm pretty sure it got
They
reported like
x-rayed
the
him.
day after. No
No.
X-ray, but no
Yeah,
fracture.
so it's a simple soft tissue injury, and but yeah, I agree with you. I think the next week is going to be the harder one,
Right.
and then another par for the course for the second
Right.
half of their season.
Yeah,
Part of the course.
add it to the list, right?
Yeah, long term, I think
Yeah.
we expect him to do fine. With a
Yeah.
simple
So
dislocation.
even though it's his throwing hand, you don't think this impacts his career down the road. Next year, we're not talking about the dislocation he had.
I don't think so.
No, I don't think so. I mean, one thing you have to worry about, right? So that PIP dislocation, volar plate rupture, right? So the stabilizing structure underneath on the palm side, and then the central slip, which is your ability to extend your finger. So
Right.
probably look at that. That's intact. He's moving it well.
Yeah.
He's an eagle, so he's going to have excellent therapy. So you're not worried about any flexion contractures
That's
or
right.
anything like that. You said it was his middle.
Yeah, this is middle.
It's
finger.
Middle, right? So better than your pointer,
Yeah.
right? For a football touch, be able
Heck
to throw your passes. So that
Yeah.
would probably be a little bit more acutely impactful, I think.
Yeah.
Coming up this week.
Yeah.
But
Yeah, I think, like you said, if it's a kind of a straightforward, simple volar plate kind of dislocation injury, he should come back fine. Stiffness is the big risk with those, but like you
Yeah.
said, he'll get great care. He's already going to be on that, and he's not going to end up stiff. So I don't see a long-term issue for him.
And the small benefit is the scheduling is that they got the Monday night game, so he gets an extra day.
Yeah.
So that helps.
I saw that, and I don't know if it's me forgetting, which is clearly possible, but I don't remember playoff games happening on a Monday night. I was
don't,
very
yeah.
surprised by that. Typically, they
NFL
wanna
football
keep
is
it fairly
almost every
even.
night of the week now.
It's
Oh
crazy.
yeah, they're just taking up all the TV slots.
And you know, let's say the Eagles do, whoever wins that game, right? Whether it's Tampa or the Eagles.
I'm sorry?
Like, yeah, understood. So let's
You mean what?
so let's say that team then has to play on Saturday. What a like deficit? What, you know what I mean? Like
Right.
Yeah. Well, it's part business, part sport.
They're conditioned for the short week, I think.
Yeah.
Not to go.
How did that work out when they were playing San Fran and then Dallas? And like that was the beginning of the attack. Like the beginning, like everyone was like, "Oh, it's totally not fair."
Yeah.
Thursday night game. And, yeah.
I thought we weren't talking about any of
Yeah,
this.
Sorry
I
about that. Sorry about
I thought we were talking about sports medicine injuries.
that. All right, let's get back on track. Let's get back on track.
What else you got?
All right, so should we stay in Philadelphia? Or
Yeah,
move
we
on?
could stay in Philly if you want. You know.
You have no shortage of injuries to talk about.
That's
Yeah,
right.
I know. The whole. I mean, we talk about Jalen Hurts and who's he throwing, but
Who's he
gonna
throwing
throw
to?
to? Exactly,
Yeah, right.
Julio Jones.
Yeah.
Great Grandpa Julio.
Grease up the knees and hope for the
What?
best.
Right. He's not complaining.
Yeah, no,
Right.
Yeah,
sure.
give
yeah.
him credit.
But no,
Yeah.
I mean, you have the A.J. Brown knee injury. I can't find much. I haven't found any official reports out about anything yet.
I gotta be honest, he never looks like he always looks like he's gimping around and getting up slow. And I mean, he's amazing when he has
Yeah.
the ball. And,
Yeah.
and
Yeah.
I've always wondered.
But I've
really
seen him go down a few
what's
times,
on-
like, ooh.
Yeah, and you're like, oh man, he doesn't look
I was
good.
like, oh, he's back
And all of
up.
a sudden, he's scoring a touchdown.
Yeah.
Right.
Yeah, I don't know.
My
So,
thing on the AJ Brown one was like, so he goes down, injury, walks off the field well, I
Right.
think, right? Came off the field well, so you're not worried about like a big ligamentous thing,
Yeah.
hopefully, if you're putting that kind of weight down. And then if you have any injury and we're like losing to the Giants,
Absolutely.
just take them
Well,
out.
I almost
Yeah.
feel that way about the whole team, though.
Yeah,
Like, I
just
almost feel about that way about,
rest.
like, everybody now. They're all, like, and, some of these guys, not to, I don't want to get too crazy, but, if they don't feel the motivation to play for a winning team that maybe is on a bad slide, they may,
Quit.
that's an 8 out of a 10 pain instead of a 3 out of a 10 pain.
Yeah.
Yeah.
Maybe I'm not sure I'm ready to get back in. And, some of it's objective, but we have to kind of rely on their subjective reporting of what their symptoms are.
Right.
And
Yeah.
I sometimes wonder about a team who's kind of on a nose, dive like
Tailspin.
this.
Yeah.
Yeah.
And I was trying to figure out what the injury was, and the best I can gather is maybe the situation was it's like one of those things where you just land wrong or you tweak your knee or whatnot, just like you're saying, and you're worried it's worse, right? And then you go and you get checked out, you get evaluated, you start feeling better, and then you look up at the score, which is at that point becoming a meaningless game, and you're like, we're pulling other players out. Why are we going to send him back in?
Right,
You
yeah.
kind of hope that was the scenario
Yeah.
here at this particular point.
Yeah. Yeah.
Yeah. So prediction is that he does play next week.
Yeah.
Yeah.
Yeah, I think so.
I think so too.
Yeah.
And then the strong counterpart to that would be Devontae Smith is dealing with an ankle injury as well that happened the second to last game. And I think it was a high ankle. I think it was reported as a high ankle sprain.
Was it high ankle?
I think. I'm not sure. I didn't really get. Unfortunately, I feel like at this time of the year there was so much.
There's been a lot of vague.
way more
reports.
vague compared
Yeah.
to like weeks 1 through 9 where we were just
Well, that's because they knew the sports medicine on tap is
Yeah.
picking the injuries apart.
yeah,
But I think that falls along the same line, though, right?
Right.
So you got one of your stud receivers, injury, even if it's close, right?
Oh, yeah.
You're just gonna sit him anyway
Oh,
at this
yeah.
point, right?
Yeah.
And see what he does.
I'm surprised he's been as healthy as he has for his size.
yeah,
I mean, we were talking earlier about how little guys get beat up in football.
Right.
right.
It's
Yeah.
true.
I-
He's been pretty resilient for.
I mean, the last 2 games are the first games he's missed in his
Right.
4 or 5 year career so
Yeah.
far. So
Yeah.
and we've all seen him take some hits.
some good ones.
So we've gone down this road superficially in the past, and I don't know if there's a definitive answer to this, but clearly you're right. If you're a smaller guy, you're more prone and more apt to have injuries. But beyond that, I do think there are some people that kind of quote unquote made of glass. Like
Put together, yeah.
they just whatever it is. I don't know what's in their genetic makeup.
Joel Embiid.
What's that? Joe Lemon B. Right. And then some people are just more injury prone. Like, and we see it like, almost like this is going to be like a kind of an extreme or nebulous version of this part of the conversation. But like, you operate on one person and their skin is like super tough, and then you operate on the next person and it's like mush, and then like, and like so there are differences in the way that
Tissue
people
makeup,
in tissue and the way that they're constructed and their milieu, and there are also differences in like body control, and now again I'm going to get even more nebulous. You have some people that like they have a knee injury and you're like, where does your knee hurt? They're like, I don't know, it hurts. Like they can't pinpoint it. It's almost like a kid who's sick. Everything goes to their belly. Their belly hurts. No matter what it is, their belly hurts, right? And then as they get older, they're like, no, it's not my belly. You know, it's like my throat, my shoulder, whatever it is. Their mind can't really identify or locate where, and I think there's a certain level of body awareness, and I'd almost even take that further. Does that then relate into like the person who's super body aware and super able to locate exactly like there are some people you come in and they have, you're evaluating them and they'll like it's not here or here or right here, like they know exactly where it hurts, and they're pointing to their knee, and then you do the MRI and that's where their meniscus is torn, like they nailed it. Is that person the better athlete? Is that person the more injuries because they have this extra body awareness and this like certain?
You are going deep.
I know.
I know.
I'm sorry.
You could do a whole podcast.
I could.
You could do a couple podcasts.
I would say something like that. It depends on the sport and the athlete too, right? So if you're talking about like either a combat sport or a collision sport or something like sort of high velocity like that, and somebody comes in and they can tell you kind of like not a complainer, right? They're never in the training room and they show up and they're like, this thing hurts right here. I do think that they have a really good body awareness. They know what's going on. They know that they're now not just hurt, they're injured, right? And so they're seeing you. The flip of that is sometimes you see maybe an endurance athlete that's in the training room every single week, and and they're they may know the exact same thing. Look, it's very specific. It's right here, but it's clearly something this is like an ongoing, or this is overuse, or this is something where maybe the physical exam doesn't quite line up with what you're telling me type of situation. Yeah. So it runs a spectrum.
Well, yeah.
Right?
I think there's a huge connection between, body awareness, proprioception, your tolerance and your understanding of what pain means to you as an athlete, and how you manifest it. And but I definitely think that so some of it's anatomy, right, and how you're put together, and then some of it's how well you control your anatomy.
So that's what I was gonna say. Like,
and then I think that I feel like kids. I gotta be honest with you. I have this weird theory. I seem to see a lot more injuries now than when I grew up, I played sports. I don't remember 13-year-olds tearing their ACLs. When I was growing up. And you see these kids, you see it happen now, and I watch I have 13-year-old twins. I watch them, and they're very active, and they play sports, and I make sure they're outside and doing stuff. But, some of their friends are fairly sedentary, right? And then they're forced to play a sport because youth sports is really, so you're going from these these rapid kind of swings of inactivity to activity, and when you're inactive, you're not developing those neuromuscular pathways to be able to learn how to control, like you would if you're outside climbing a tree or jumping over a log or doing whatever we did when we were kids, or I did when I was a kid. You guys don't have as much gray as I do. But, so I often wonder,
rolling that can down the wheel.
If we're seeing some of this stuff because of the change in some of our society and the way we are getting deep. What are we doing?
We're going off.
Really good. So anyway, it is interesting to think about, because I think about that stuff, because we have this, the Energy Lab, we have this really strong interest in injury prevention, and I think some of those things apply to that. Like how active is your kid, and are they sedentary for 8 hours a day and then active for 2? Well, you might have a higher likelihood of not having good body control and have not developed those neuromuscular pathways to be able to control yourself. And
I think even like roll with the hit. You know what I mean? Like,
well, there's an art to that. That's not everybody knows how to fall. Not everybody knows how to roll. Not everybody knows how to control their single leg when they're standing on it. And all those things lead to bad.
To that point, that's why, and I didn't do this, and I wish I had. And they don't have to do it competitively. They don't have to do it forever. But kids that are involved at an earlier age in either tumbling or gymnastics, right? And they
remember the little gym thing. Do you remember that business?
You learn how to fall. Mm-hmm. You learn proprioception. You learn air awareness, right? So in terms of like, if you want to go into, you're doing like aerial skiing, right? They're all gymnastics people. Like
Right.
everybody that understands like gravity and spinning,
Yeah.
how to fall, how to take a hit, how to not get hurt all the time.
Right.
That like I think the core of that is
Yeah.
like some sort of either gymnastics training or tumbling training when you're younger. Obviously, that's a super competitive sport. So, do you have to continue that onward? No, but it gives you, even if you're going on and then you turn 10 and you're playing soccer now.
Good
Great.
foundation.
Yeah, it's just a foundation.
foundation.
I don't think-
it's like an athletic foundation to build
Right.
on.
Yeah.
So,
I don't think this has ever been discussed, but I actually did gymnastics for 3 years.
All right,
When I was
man.
a kid.
Yeah, yeah,
And
yeah.
can we
Probably made me the elite athlete that I am.
can we get a,
That's
can we get a
exactly how you
back,
got
back
that.
handspring real
Yeah,
quick?
I actually can do a round off back
After
handspring.
that beer,
I
it
can
might
still do that. I'll do one of those on the beach every now and then.
Or just
Yeah.
show off a little bit.
Yeah.
Kids, watch this. My ACL.
8 out of 10 times I land it. Once, mouthful of sand.
8 out of
And
10
once I
times it
stop,
works
once I
100% of
stop,
the time.
once, and the last time I pull up.
Well, no, I think that's something to be said too, because I think the art of falling was something that was a mild focal point in regards to talking about Tua this year for Miami, because of last year how bad he was falling and getting like serious concussions
Right.
and like consecutive weeks and all that, all that stuff that was the spotlight was on him. And I think he took up jiu-jitsu to learn how to fall better.
Yeah.
Um,
And roll.
yeah, and just to roll with it versus smacking your head and having no neck strength and just having all those issues.
Yeah,
whip
and
wedge.
and that you take that to the next level in orthopedics, and we see, we're sports medicine, but we take some call, and we see patients that come in with hip fractures routinely. I mean, it's almost like it's an every night thing, and a lot of those patients are elderly patients who lose their balance. They have no idea that they're losing their balance until they're probably halfway down,
Right.
and they hit the ground like a tree falling.
Right.
There's no anticipation of the blow. There's no roll. They don't fall into it. They don't brace properly, and that results in a fractured hip.
Yeah.
And if there are fall programs for older patients and balance programs, and those are all important skills.
So speaking of Miami and Tua, let's go. Let's just take it to
That's
a couple of injuries
that's
over
nice.
there.
That's nice.
Thanks, man. So the first one, I think is pretty easy. Bradley Chubb, ACL tear. We anticipate seeing this guy back.
Yeah. So I think you could teach him to cope with his injury and
Did they put an internal brace on it?
sprinkle in some
Well said. Well said.
growth factors, and he'll be fine.
All right, next.
No, I think we all agree that's a season-ending,
that's season.
if not career-ending, 55% of the time in the NFL.
Wow, that's a big number,
Yeah.
right? And I think it's a great point to bring up because I don't think most people consider that as a possibility
Yeah.
No.
until you're faced with it and you're struggling to get back.
And
or
that
whatnot.
doesn't mean he didn't have a successful surgery,
Right.
It just
Right.
means he didn't get back to his prior level of play.
Exactly.
That's-
Lose a step. You're done.
Yeah.
And when the margin for error is like nothing, right?
The
Like
more
that-
elite, the higher the percentage that don't return.
Yeah,
Yeah.
that's
Makes
exactly
sense.
right. Yeah. And then the guy that Tua was throwing the ball to, and I think this is a big question mark. So injury December 31st, right? Phenomenal player. Maybe just a hair below Tyreek Hill, or close to equivalent. Jalen Waddle, they were reporting as high ankle sprain. We've talked about it a couple different times on the show. That one particular injury, we tend to have Dr. Brandon here over and over again. What are your thoughts? So December 31st, did they win it? No. Who finished first in? No, Baltimore won.
Baltimore,
won.
yeah,
So they have
yeah.
the first round bye. Sorry about that. And so coming up, 2 weeks later, now who wants to tackle this one first?
I think it depends on the severity of the sprain, right? So
Right.
we don't really know that. But if it is a relatively low-grade high ankle sprain, could he get by it with something like taping? Yeah. Is he going to be as effective as he normally is, right? An explosive receiver, running routes, cutting. Could he get back to it? Potentially, but it would be a relatively low-grade sprain, and he might not be performing at the capacity that he normally does.
Right. And how good is he going to feel playing at Kansas City at 0 degrees on Saturday night?
Is that
see
the
the-
forecast?
It's supposed to be like within in the single digits
Yeah.
cold.
I think I saw something today that Tua hasn't won a game under 45 degrees.
Yeah, I think
that right?
the
Yeah.
The Dolphins are. I saw it on the TV behind you. They said they're 0-5 in games where the temperatures are below a certain point. They don't do too well in the cold.
Soft.
It makes sense, right?
Right.
I
Yeah.
mean, if you
It
That's why I
hurts
always
to be
used
in
to
the
wonder
cold
why
when you're not
Denver.
used to being in
I
the
always used to
cold.
wonder why Denver couldn't outperform people in the fourth
Yeah,
quarter.
playing at altitude
Yeah.
like that.
Yeah.
It's a huge advantage.
Should be.
Well,
Yeah.
you think the same thing with that?
Same
is
thing
that,
with cold.
Miami, I saw something one time is that the way their roof is that the sun shines on
Yes.
the away
Yeah.
side.
Yeah.
So
That's by design.
Brutally hot.
Is that
Yeah.
right? Really?
Yeah,
Oh,
so
yeah.
it's about 20 degrees hotter on the away sideline when you're a visiting
Yeah.
team in Miami playing the Dolphins.
That's
where
hysterical.
the shade is on their side, so
That's
they're about 80
unbelievable.
degrees, and the away team's about like 100 some degrees.
If you sit visitor side for like a preseason game in August,
Oh, I
it's
can
like
imagine that's brutal.
unmanageable.
Yeah.
and there's no breeze.
Yeah.
You're just- you're
I
like,
can
we're not
imagine.
moving. You're just in
Yeah,
a chair.
that's miserable.
dying.
The reason I don't think the cold weather teams have as much of an advantage nowadays as they may have in the past when a warm weather team comes up is because those cold weather teams are not practicing in the cold either.
Right.
They're
Yeah.
indoors, great control.
You're probably
of
right.
conditioned
Yeah,
environment.
you're probably right.
So they're feeling every bit of pain from being out in the cold, just like the warm weather team is.
Psychology.
Yeah.
Yeah, for
Gotta
sure.
love Lambeau though. Open
Yeah.
field, Green
Yeah.
Bay.
That's
no
sweet.
dome. It's never gonna happen.
It's spectacular. I know. Old school. Where do we want to go next year? We got a whole slew of options.
We can change it up a little bit. I think we talked about Green Bay, so we can talk about the Green Bay game against
Okay.
Dallas. And I think Dallas took a decent injury hit with Stephon Gilmore, one of their cornerbacks, with a shoulder
Whoa,
dislocation.
good player. Really good
yeah,
player.
really good. I mean, he was top of his game when he was with New England back in the day. Kind of have a mild resurgence in Dallas. He's doing
has,
pretty
right?
good, doing decent.
January 7th, dislocation?
Yeah, this past weekend he. There was no formal report, but there was him after the game in the press conference. He goes, "Yeah, it popped out. They popped it back inside for me, and so I'll be fine by next week." It's kind of what
That may actually be.
Yeah. So, but on the other side of the issue, right, John Morant, we're changing over sports, but I mean, this might be a conversation for the near future. Yeah, right on, shooting hand. Torn
Walked
labrum,
right
dislocated
into it.
shoulder, torn
Yeah.
labrum,
Yep.
getting surgery out for the season. Brad, I'll bring it over to you for why does one guy go down the road of getting surgery mid-season and the other guy has it pop back in potentially and maybe go back that game?
Yeah.
What are some of the differences?
Well, I think there's a difference between basketball and football players. I'm serious.
fair.
There's
For sure.
mentality
To that,
perspective.
certain toughness, yeah.
But I also think that
hockey players.
hockey players for sure.
Right.
Like so in general, I think we've kind of established that a single dislocation, first kind of dislocation for an athlete, simple dislocation meaning it doesn't involve bone or any kind of complexity that's not expected. We can allow that athlete once they've regained full range of motion and full protective strength, we can allow them to get back to a season of football. So typically for a football player, typically when you dislocate, you tear your labrum, which is this kind of this stabilizing bumper around the socket in the shoulder, and you can get back with certain protections. Typically something we call Sully sling, which is a brace that helps protect against the at-risk position for recurrent dislocations.
Can you wear that as a cornerback and be effective?
Yeah, so that's the thing, right? So it's very position dependent, and you can, but again, as we spoke earlier, you might not be the same version of the player that you were before you got hurt, but you may still be better than the second team guy.
Right.
So it really depends on that. Basketball players maybe a little bit more at risk for the at-risk position. They're constantly overhead, which Sully sling does not let you do,
Right.
and likely it doesn't make as much sense and not as tough as football players.
Not
So
as tough as
I think some of those things I think play into it. The risk is with recurrent dislocations, if you let somebody go back and they're a little bit more prone to dislocate, which we know people who have a dislocation and a labral tear are, then you can start to cause more damage in the shoulder. You can start to cause cartilage and bone loss damage. That makes it more complex. Now you might not be able to do an arthroscopic repair that labrum tear after the season. Now you may have to go do a more complex surgery called a ladder J procedure, where you basically have to rebuild the front edge of the socket in the shoulder with a bone graft, and that's it's a bigger animal, more complex, less certain outcomes. But
Right.
so I think those are some of the reasons we let certain types of athletes in certain sports get back versus others. Something specific to the nature of their sport and what it requires.
Have any of you guys had those guys that were, they're covering the sideline, they come running out and their arms dangling, like, oh, I think my shoulder's out, and you pop it back in, and they're like, oh, great, and they're ready to go right back in, and this is their 13th dislocation, and you know what I'm talking about?
Yeah.
how come that person doesn't have as much issues or as many issues, and it's just a matter of getting it back in and getting them back out there?
I mean, that individual, I think they come out with a relatively low level of energy, right? They're inherently lax. And so when they come out, it's not as traumatic. I think, they may have some underlying structural damage, which you were speaking to with like the bone loss, but many times they're just inherently lax. And so when they come out, they're not creating a lot of damage. There isn't a lot of torn tissue. It's not as painful. And so they're able to get back.
Yeah.
They're also going to come back out again, though.
Yes.
Right. Oh yeah.
Yeah.
Just hopefully not that
Just a
game.
time bomb waiting to happen.
And they're also going to have arthritis when they're 50. And they're going to need something else.
And I think with that too is like the management of it over time is that you see those episodes of dislocation, the time in between end up sometimes shortened. It's like, oh, you made it like a day or 2 or a week or 3 weeks. Now it's like every other 4th day or whatever the case is. And I've had it in both cases for football and basketball. I had a basketball player once who was dislocating all the time, but we managed it through a season. But then towards the tail end, he couldn't play defense anymore. One arm wasn't going up anymore. And then we had that discussion of like, well, you're going to make your life living hell down the road. We got to fix this now. What's college basketball for a little bit? And same thing with football. I think the benefit of, being able to push them through is that they have the protective equipment and they're wearing the equipment that you can add equipment to. You can have the stabilizers that can hold the shoulder in a little bit more. Whereas basketball, you can wear it, but it's definitely not as commonplace.
And I feel like there's the saying the tubs, the traumatic, unidirectional, Bankart, and surgical, and Ambry, and physical therapy, multi-directional one. And there's a distinction. Like you have the one person who has that dislocation, that traumatic dislocation, and they continue to try to play, and their shoulder is getting worse and getting looser. I was sleeping last night and it popped out.
Well, right, the energy required to dislocate it
goes down, and they're losing bone stock. They're losing the tear in the labrum is getting bigger. Then you have the other person who's just super loosey-goosey, super flexible. And they go out easily, but they do now and they will for the rest of their life. And like you were saying, when they go out, it's actually so loose that it's not the same level of trauma. And you just slide it back in, and they're pretty good at coping and keeping it in for the most part. So you do get this whole spectrum of different kinds. And you can't treat every single one the same.
And I think that's another thing to kind of link it back to our previous discussion about proprioception and body control and awareness. I think some athletes you watch move, and they just when they move their arm, they just let their shoulder kind of slide into these awkward positions. And if you add a little extra energy to that, boom, they're out. Versus somebody who's protected and braced, and their scapular control and their muscles and they're primed to kind of keep everything in the right spot before they engage other athletes. And I think these are a lot of the things that they're hard to measure those things. It's hard to teach those things because I don't think a lot of people think about them.
So now we're going to go down this rabbit hole again. But so there's a lot of wearables and data collection. And I wonder if some of this stuff is going to become more there are injury prevention for ACLs and whatnot. And is it going to start to become a little more mainstream and
it
body
should
movement and training away from the injuries?
So we started using this Dorsa V system at the Energy Lab, where basically you can put on some, where you're familiar with the Dorsa V? It's like a wearable, FDA-approved device, wearable kind of.
It's like a motion sensor, right?
It's like a motion sensor device. You put a couple sensors on the tibia, low back, and pelvis, and you go through a battery of tests, and there's certain validated tests that are kind of through the company that's been FDA approved. It's valid information. And it shows you how your body's moving, they've got accelerometers, they've got angular detectors, and so we've got all this stuff where we can look at you can look at a pre-op and say, hey, you're high risk for some of these factors we see for ACL injury, or you're post-op, you're not passing your return to play test, your limb symmetry index isn't right yet, and so I think you're totally right. You plug that information into an AI, right, where it will start to say, okay, you're not here yet, this is what we need to do, and refine some of the models of how we rehab people. Right. I think that's pretty cool. I mean, that's kind of exciting technology, and it's limited right now to certain body parts and certain protocols and diagnoses, but I think eventually we'll be able to expand that to other things, because right now it's really hard to do that in shoulder. I'm not aware personally of any information, the wearables to look at shoulder instability. it's such a
Calling old
strange
interns.
joint.
Start collecting data.
Yeah.
The one other thing I did want to touch on, though, with the just coming back full circle in sports medicine with this dislocation. Say he comes back, right?
Yeah.
Comes back, full motion, full strength, doesn't come back out, right? Goes through the playoffs, God forbid. Hopefully
then
they're
what?
out very quickly. So, but the reality, I think, right, the literature supports now, no matter what, even if he's sitting there postseason, he's like, I feel great, you fix it.
Yeah.
Right? You take him to the OR and you fix it because he's off season now. He's got the time, and his likelihood, age, profession, collision sports, like he's coming back out unless you fix it. So that's a hard conversation, I think, with athletes. A lot of times, especially with athletes with parents, is that I know you feel great.
Yep.
Right. And I guess it depends if you're going to play at the next level.
I show him pictures of what happens next.
Yeah.
And
really?
Yeah, bone loss, cartilage damage. I have a couple stock pictures I'll show him. And then, I trained at UConn with, Arciero. Bob Arciero is like one of the godfathers of sports medicine. Did all the original shoulder instability studies at West Point, looking at a very active young population. And it's, I don't want to say inevitable, but if you're going to remain active,
Pretty high.
90+%, 95+%, that it's going to happen again. And it may be, because you're reaching in the backseat of your car, maybe because you're putting your arm around your girlfriend or your boyfriend or whatever, whatever.
You never know.
The other thing too is is he a slap or was he a dislocation?
I don't know. It's a great question.
Yeah.
I do not know.
Because that's the other, why is he getting so for a slap, shooter, basketball player, I guess you try to rehab it,
I would try to rehab that.
but if he's failing that, then
But he's getting.
But that's
surgery
safer
now.
to rehab than a banker.
Right.
yeah, exactly. And I feel like I don't see a ton of dislocations in basketball.
Right.
I don't.
Because they're not,
Very-
because
yeah,
they're
they're
not
very
working that hard.
And they don't fall that way. And they're not like, Stephon Gilmore, I don't know exactly his body makeup, how big he is, but he's a cornerback, so he's generally a smaller guy. He's tackling much bigger people most of the time. And my biggest thing with cornerbacks is they just don't know how to tackle that well.
Yeah.
Unfortunately, across the board, you see these people who just dive at legs.
They
and
like to
hope for the
run
best.
into people fast.
Yeah.
I can tell you if he comes back with a Bledsoe or a Solion, I'm that quarterback.
Yeah.
I'm targeting him
Yeah.
every
There you go.
time.
I agree.
What are you gonna do? This is what you got.
You put your tallest receiver out there.
Right.
Super.
Let him go up. Steelers playing Buffalo.
Steelers again.
Yeah. You know where my mind is. Gabe Davis, tight end, pretty good player.
Yeah, I
Knee
mean,
injury. Do we have any details about this?
I
particular one?
believe it was reported as a PCL sprain. I'm pretty sure he got tackled and he got kind of just slammed right down on a flex knee.
Oh. Right.
Kind of like almost textbook.
Classic mechanism.
Yeah, classic mechanism for that one.
Yeah.
And he's kind of like their.
Dashboard
With a
ass.
plantar flexed ankle.
That's right.
He's doing a
What,
research.
what happens if he was dorsiflexed when it happened?
Kneecap contusion or fracture.
Fracture, yeah.
Wow.
Standing right off the boards right there.
Yeah, for all you students out there listening.
So that would be interesting to see. He's kind of like their number 2 guy.
Yeah.
And he's kind of like the over-the-top guy. He's got a lot of big play potential, so we'll see where that goes.
Right. Is he tight end or wide receiver? Do I have this wrong?
Receiver. He's a
a
receiver.
I'm
Yeah.
sorry about that. Yeah. I don't know. So let's throw it out to our guys here. PCL sprain. What do you think? And this is a recent injury. This happened, just this past week. It's an unusual one, right? Like it's not something that we commonly see. Is there a chance that he's playing this coming weekend? And I get it. Like we have very little information here, but what do you think?
I think maybe. So you got to see the guy, right? Does he have any knee effusion? Because if he has an effusion, then I think clinically he may have some sort of real PCL sprain.
Right.
But I hate to say it, but you get an MRI, you're going to see some bright signal in the PCL.
Yeah.
60% of the time, 70% of the time. So, is it clinically relevant? Is there actually a sprain back there? I don't know.
Yeah.
Unless there's, clinical evidence of a knee injury with an effusion and I'm worried about some intra-articular process going on, then I would say probably not. But if you just had pain and out of an abundance of caution, they got an MRI, and the MRI, they're like, it looks like a PCL sprain.
Right.
I don't know. Seems a little unusual.
Yeah, I agree. I think, if he's got an effusion, his quad's going to start to go quiet. And he's going to have limitations that probably have less to do with the PCL injury than, with the secondary effects of the injury, swelling, weakness, apprehension. we know that NFL athletes can play with a full thickness PCL tear,
Right.
and sometimes not even know they have it after
where
they
I
get
was
through
going. Yeah.
after you get through the acute phase of it, which is the part that kind of limits you a little bit. So, 2%,
Right.
3% of D1 college football players that enter the NFL draft go through their preseason like kind of checklist with
Evaluation.
The combine,
and
all that stuff, yep.
and they find previously unrecognized grade 3, which is a full thickness PCL tear.
Yeah.
And they just are so strong and athletic that they can cope and compensate for that. Typically, if you can develop quad strength, greater than 90% of the opposite side, then you can function pretty well even at that level. And most of those guys have 90% or greater quad strength, even after an injury. So, so the question is, how much does that acute inflammation and injury that's secondary to the PCL affect him?
It's interesting, and I find that with ACL tears, if somebody is like agreeable and willing to kind of change their lifestyle, give up a certain level of activity, you can cope and you can function pretty well. And when you have a PCL tear, it's like the opposite. You tend to do fine with athletics.
Yeah.
But if you have that symptomatic tear, like you can't. It bothers you with your everyday activity. I can't climb the stairs or go down the stairs. Like it's odd. But you can be pretty active despite the fact that you have that PCL injury. It's just the everyday stuff that tends to be a problem if it's a problematic tear.
Yeah. Those are tricky.
Yeah, they are. And then the other issue is that, as we all know, like when you do actually then go and fix them, if you need to, they can't get over the hump. They all tend to stretch out a little bit, right? Like they're not perfect repairs.
Yeah, without a doubt. I can't say I've been remarkably satisfied with the knee stability. You put it in there, rock time 0, a rock,
Spectacular.
absolute rock. You're like high-fiving, it's going to be amazing. And then 6 months later, you're like, it's loose.
Yeah.
Feels loose.
All of mine do great 100% of the time.
I was waiting for it, man. I knew it was coming.
60% of the time, it works 100% of the time.
That's right. No, I agree.
No, I'm going to go in a little bit of another direction. Rookie, tight end. We were going to talk about tight ends. And this guy had some year, man. He was really impressive. And I'm not talking about the tight end on Buffalo, Kincaid, but on Detroit, Sam Laporta. So being reported as bone bruise, hyperextension injury. Also happened January 7th.
In a game where he questionably didn't need to play, right?
I know.
Detroit's doing really well. They're in the playoffs for sure.
Right.
Then your top guy.
Yeah, by far. Like they're a different team without him. Like
Yeah.
he's a really good player. Yeah. What are your thoughts? You want to tackle it for us?
Yeah, I mean, I think it's very similar to what we were just discussing, the PCL, right? So bone bruises can be really problematic, even though structurally the knee is fine. If you have a hyperextension injury, you get the MRI, he's got a bunch of increased swelling in the femur and on the tibia, kind of one of those like kissing lesion type of things.
You see it all the time, right? Like
Yeah.
it just lights up.
Yeah, and that can be, it can create the effusion, it can be really sore, but he hasn't structurally damaged anything. That's tough to get back from in an acute time frame. Now, if you got the MRI and again, there's no effusion, not a lot of inflammation, you just see it's sore. Okay, yeah, then maybe some NSAIDs before the game, and let's get out there and see how you do. So
Right.
it just varies on their clinical picture a little bit.
I think we did a whole podcast on hyperextension.
Joel
bone bruises.
Embiid.
Yeah.
We did one of our
Yeah.
first ones. That's exactly
Yeah.
right.
Mr. Soft.
Good work.
And I think this is similar to
He's
speak.
amazing.
Tight ends
Yeah.
was similar to Travis Kelce at the beginning of this year. I think he had this.
Oh, was it really?
I think Travis Kelce had some of that going on, a little knee injury, hyperextension, bone bruising.
And the thing that we talked about that I think is really the wild card too is not just the acute phase, but what happened to the cartilage cells that are, in between those bones that get crunched, because
Right.
they inevitably get injured as well. Bone heals pretty well
Yeah.
over time.
Yeah.
Cartilage cells do not, and very often there is a long-term kind of sequelae of a bone bruise that may seem relatively benign on the original images.
Yeah. So this rookie, his career just ended. Is that the prediction that I'm hearing you make?
No, not yet. Those guys are tough. They're football players. They're not basketball.
So and then also you don't know like the extent of it, right? Like is there a tear? Like when it goes forward, you get that the kind of bone bruising in the front, but then you also get a little bit of stretching of the capsule in the back. And then if that's really bad, then that stretching the capsule in the back actually then becomes stretching of the ACL, kind of your next restraint. And then if that's really bad, that becomes tearing in the. Presumably that's not what he had, right?
Yeah, trickle effect.
Yeah. But I don't know if you have to gun to your head, you gotta make the call right now. Is he gonna play this coming week? And I know again we don't have all the information. There's certain gradations of this.
That's a flip. We just don't know how severe it is.
Right.
Because a bone bruise can be pretty mild, and it can be also pretty severe. So without an image, I don't know.
So you don't want to guess?
No.
Okay. And you, Kevin?
I'm gonna say he's gonna play.
He's out.
I'm guessing he's playing.
He's out.
I'm gonna say he's gonna play just because of where it is in the season.
Right.
Yeah.
So important.
Yeah. And he knows
The big stage, Detroit's first
he's
home game.
He's got to demonstrate that he deserves
His toughness.
another season, and he's got to get through those 3 years before he gets a big contract.
This guy's demonstrated he deserves it. He's a good player, man.
Yeah.
Certainly is.
I don't know where else.
I think we touched on just about everybody.
A lot of the big ones.
It might be time for a
There are
milk
numbers
tube.
out there.
Yeah, it might be milk tube o'clock.
Milk tube.
Milk tube o'clock. I think that's a T-shirt.
That's true. Yeah. Well, that is a T-shirt, but then also separate from that Sour Fest, May 18th.
May 18th, yep.
Oh, nice.
Yeah.
Put that
Sweet.
in your calendars.
Yeah.
I like that.
That'll be a good one. May 18th outside here at Total Turf for Neck of the Woods Sourfest.
Lime watermelon.
If
It's my favorite.
they're taking suggestions on Instagram on the Neck of the Woods.
They
Instagram.
already make that. I know he knows I like it. So
You already put your bid in.
We're good.
Absolutely.
yeah,
So I think we're good, right, gentlemen?
let's do it.
I like
All right. So before we go ahead and close out our tab, we're just going to give a quick shout out to our sponsors. Magic Mind, as mentioned earlier, a nootropic blended shot, if you will. They have a special going only this January to help you gear up and crush your 2024 New Year's resolutions fully focused. You get 1 month for free when you're subscribing for 3 months at magicmind.com/JAN MedOnTap. And using the code MedOnTap20 at checkout gives you an extra 20% off, which gets you a grand total of 75% off, and this only lasts until the end of January, so hurry up before it goes away. Protected is a custom bracing company that allows sports medicine professionals to have unprecedented access to 3D technology. With a quick 3D scan on your iPhone app, you can have custom fitting braces arrive as little as 48 hours. Protected is a tool that should be in every athletic trainer's toolbox. Learn more by heading to their website, www.protect3d.io, or downloading the Protected app on Apple iStore. And lastly, our other sponsors are Energy Lab, the region's premier sports performance center and destination. Neck of the Woods Brewing Company, serving us up the most delicious beers in the local South Jersey area. And Timber Reel Production, helping us put this whole thing together and getting out to all of our supporters. Thank you again. Have a great night and stay safe, everyone.